I've got a few slides that I want to go through, but the basic point here today is that no matter what one thinks about the various healthcare bills that are out there and the prescriptions, the various prescriptions that have been suggested, the status quo is not an option. And for me, this starts with fiscal responsibility. We have seen just an unbelievable explosion in debt in our country, from $5 trillion from the beginning of the previous administration to $12 trillion today. And if you look at what's causing it, you can see on this slide that this is our revenue line, that the biggest drivers of our deficit are the interest payments that we have on this debt that we're managing to pass on to our kids and our grandkids because we're unwilling to make the tough choices that need to be made, and rising Medicare and Medicaid costs, which is the red line right here. So one cost of inaction is that we will continue to drive these insane deficits that we're facing as a country. In my state of Colorado, the senior senator from Colorado is here as well. Our working families and small businesses are suffering mightily because the economy is not working for them. Over the last decade, median family income in the state of Colorado has actually declined by $800 in real dollars, Mr. President, and that's happened all across the United States of America, where we see median family income down by $300. At the same time, health care premiums have risen by 97%. The cost of higher education, by the way, has gone up 50%. Our working families are being asked to do more with less just for the basic necessities that are required to move your family ahead. These are not nice to haves, these are essential if working families, if the middle class is going to be able to move ahead. The second reason we need reform is, as the senator from Virginia said at the beginning of his comments, we're spending almost a fifth of our GDP on health care. That's more than twice what every other industrialized country in the world is spending on their health care system. And as I've said in town hall meetings all across our state, this is no different than if you've got two small businesses across the street from one another, one spending a fifth of their revenue on their light bill, and the other is spending less than half of that on their light bill. You don't need an MBA to know which of those two companies is going to be able to invest in their business plan and grow their business. We have a lot to do to make sure this economy can compete in the 21st century, and I would say that one of the things we ought to do is not devote a fifth of our economy to health care if we expect to compete. This shows the rate of insurance premium increase in our state versus the rate of the increase of wages. And these are absolutely related to each other. You talk to small businesses in any state, I'm sure this is true in Virginia as well as it's true in Colorado. Small business owners are desperately trying to keep their employees insured, but the choice they're making is to pay them less in wages. This wage compression is related directly to the rate of insurance premium. The other chart on this slide simply shows, Mr. President, that if we change nothing, there are going to be families all across this country who by 2016 are going to be spending 40% of their income on health care. That's before you get to higher ed. That's before you get to the rent or to food. 40% of every dollar on health care. It's absurd. And we see that health care is bankrupting middle-class Americans all over this country. And what's staggering to me, we know that 62% of bankruptcies are health care related. What is staggering to me is that 78% of those bankruptcies are happening to people that had insurance. The entire reason people buy insurance is so they have stability when their child gets sick or their spouse gets sick or they get sick. 78% of these bankruptcies were caused to people that had insurance. And then finally, no one is burdened more by the current system than small businesses and the employees that work for small businesses. In our state, small business pays 18% more for health insurance just because they're small. And when I say that, sometimes people say, well, Michael, don't you understand that that's because the pool is smaller? It's harder to spread the risk. And I say, I understand that, but from a business point of view, and the senator from Virginia and I both have spent a lot of time in our careers working in the private sector. From a business point of view, that is absurd, because these small businesses, if they're investing 18% more, ought to be expecting to be 18% more productive, or at a minimum ought to have 18% better health care, and that's absolutely not the case. My final point, Mr. President, is that we've been having a healthy debate about how we should do this reform. And there are a lot of people that are concerned about things like a public option, things like government control over health care. I would argue, Mr. President, that the status quo is what's producing that, because fewer and fewer of our working families are covered at work, which is what this slide shows, and every one of those people that then goes on uncompensated care is paid for by the American people. So I join my colleagues today in saying we absolutely cannot maintain this status quo. It's absolutely unsustainable, and I look forward to a thoughtful, common sense reform that works for working families and small businesses in my state. Thank you, Mr. President.